Hi, my name is Brett Jones, and today I'll be conducting an informative presentation about the disease called lupus and everything that you need to know about this disease. Um, my mother was diagnosed with this disease in 2007 and has lived with this disease the last 14 years. I also had a cousin who passed away from this disease back in the 80s, so this disease is near close to home. So I've conducted extensive research on this topic, and today I'll be explaining everything you need to know about this disease. Um, a little bit about what we'll be talking about is what actually is lupus, who can get lupus, what you should know, how to live with lupus, the treatment of lupus, celebrities who have lupus and are living with this disease and the battles that they face, and how you can get involved. So, what is actually lupus? Lupus is a serious disease that attacks your immune system, and this actually can affect anyone. Of course, our immune system is our body's defense against infection and disease. Lupus is a chronic and complex autoimmune disease in which your immune system attacks healthy cells by mistake. This can potentially damage many parts of the body. Um, Lupus can affect the joints, skin, brain, lungs, kidneys, heart, and blood vessels, causing widespread inflammation and tissue damage in the affected organs. The exact cause of lupus is not known, and there's no cure for lupus as of today. Lupus is not a contagious disease. The most common type of lupus is uh, known as SLE, which affects many parts of the body. There are other types of lupus, such as lupus that can cause a rash or lesion on the skin, usually when they are exposed to sunlight. Neonatal lupus, this actually occurs in infants, which lupus is then passed from their mothers. And then people can actually have both SLE and cutaneous lupus. And cutaneous lupus is the lupus that does uh, cause a rash. Um, so during this presentation, when I discuss lupus, I will be most referring to SLE lupus. So who can actually get lupus? So anyone can get lupus. SLE, uh, it affects from 161,000 to 322,000 adults in the United States. Some people that have the greater risk of getting lupus, women who make up 9 out of 10 adults who have this disease. Lupus most commonly first strikes between the ages of 15 and 44. Women of African American, Hispanic, Asian, or Native American origin are more prone to get lupus opposed to Caucasian descent. African American women are actually 3 times more likely than Caucasian women to have lupus. And actually, a family history is also a risk for lupus as well. So some facts about lupus that you should know. Of course, not two cases of the lupus are the same, so it's a case by case basis. Um, 50 to 90% of individuals who are suffering from lupus, they identify fatigue as one of their primary symptoms. Fatigue can significantly impact the patient's quality of life, including lessening the ability to function at home and at work. Um, there, most people with lupus experience unexplained fevers, so temperatures over 100 degrees Fahrenheit. Roughly 30% of lupus patients experience molar rash, which is also called a butterfly rash, which is on the nose portion of the face. Um, Up to 90% of people with lupus have arthritis, which is the inflammation of the swelling of the joints. the most common symptoms of arthritis are stiffness and aching, most often in the hands and wrists. Uh, and some patients of lupus actually experience hair loss, seizures, restriction of blood flow to the hands and feet, sensitivity to the sun, depression, bone thinning, weight changes, and dryness of the mouth. But lupus symptoms, they do come and go, um, which can be a result of what is known as a lupus flare. Um, so patients that live with lupus, this is a constant daily battle. So they will have good days, and they will also have bad days as well. Typically, when they do have bad days, they have a flare, and these flares can be triggered by many different things. So, such as the weather change, if they're cleaning and they're exposed to certain chemicals, they can go into a lupus flare. If they are experiencing more stress than they normally do. Um, but this disease really affects their day-to-day life. Um, they are actually also have a higher risk of kidney disease, diabetes, and cardiovascular disease as well. Um, and the symptoms can't be predictable, so it just depends on the day, the weather. So, it can be hot and they can be fine, and then if the weather gets cold, then they can also go into a flare and experience more severe symptoms. But if a flare becomes really serious, lupus patients are encouraged to meet with their doctors to determine if any other additional steps need to be taken, such as being put into the hospital as well. Um, so being treated by lupus, it just depends on the symptoms. So you can be put on certain type of medication, immunosuppressants. Um, Again, everyone's symptoms are different, so it depends on their doctor who will diagnose them and determine what kind of treatment is necessary, such as higher dosage of medications or reducing certain dosages as well. And again, with the medication that certain lupus patients take, they can have side effects that can affect um, each patient differently. So a few celebrities that have lupus and are living with this daily battle. Um, R&B singer Toni Braxton. You have Nick Cannon, Selena Gomez, Kristen Johnston, Lady Gaga, and Paula Abdul. And there are other celebrities as well that do have this disease and are advocates and also speak about their daily battles with lupus. So a few ways that you can get involved with lupus research, lupus awareness. You can talk to your friends, the Lupus Foundation of America, the Lupus Research Alliance. Um, you know, every year they have lupus walks all across the country to really show support, and the research is um, really improving to hopefully find a cure for this disease. And that concludes my presentation, and thank you so much for listening.